C5 nerve flossing is so important for symptoms that people may have going down your arms. Basically, nerve flossing is, imagine having a shoelace going through a straw. So you can pull the shoelace from one end and the other end, and you want to make sure that it slides back and forth. Your nerves don't like to be compressed. They don't like to be stretched. So nerve flossing is a great way to floss this shoelace back and forth and to try to loosen things up without damaging the nerve. So nerve flossing is very helpful when we suspect irritation of the nerve, or maybe the nerve going through a dense tissue and being irritated as a result of compression there. Or perhaps there is a stenosis or narrowing of the holes where the nerves come through, and there is a mechanical compression of the nerve in that area. So to do nerve flossing, I'd like for you to think about grabbing doing a fist and turning so your pinky is up, just like so. So if the nerves go from your C5, from the middle of your neck, and they go down to your arm, what we want to do is we want to slide, we want to pull from one side and give on the other side and reverse. So generally speaking, what you want to do is you want to stretch like so and bring the neck towards your shoulder, and then you stretch. Let's straighten that and straighten your neck. So back and forth, back and forth, back and forth. The next thing that you want to do, and by the way, if you have symptoms, you want to keep doing it and do that for a good week or so. That is what I recommend to my patients, for a week or two before they move on to the next level. The next level is we want to create a little bit of a bend to that area. And so we are doing it this way. Still the wrist is bent the other way, and you're doing that. And what you're doing is you are trying to bring the neck that way, stretch, stretch, stretch. And the next level of that is when you are bending and you are stretching your neck the other way. So like so. There are so many different varieties of nerve flossing, but the one that I find to be helpful is the one that I shared with you. Once again, this is like sliding the shoelace in a straw and going back and forth, back and forth. So if I stretch my neck the opposite way, that will stretch the nerve. And if I come back to neutral, it is not going to stretch it as much. So once I stretch from one end, I want to give on the other side and go back and forth, back and forth. Thanks for watching.